Birth encompasses all of the human experience. That's why I love it so much, because I get to see the rawness and the honesty. And that's what people choose. And that's a beautiful thing. And if you are willing to go there, it will make you a better mother. It will help you on this life journey, you know.
Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everybody, welcome back to the podcast. Today is an emotionally charged day. We get to talk with one of our favorite people. In fact, I have two of my absolute favorite people on the podcast today. So first of all, we have Monika Stone. I'm going to tell you a little bit more about her, but I also have Sarah Crawford, who is my wife. So, and I'll tell you why Sarah's with us. This is a really emotionally charged day. It's going to be fun. It's going to be a fun conversation. But Monika is a midwife. She's an author. She is a FDN practitioner, which we're going to talk about more about what that is. And she's also a public speaker. I would say that she's more than that. She is just an amazing person. She helps bring people into this world. She helps mothers and families go through some of the most amazing parts and sometimes some of the most challenging parts of their lives. And she does it beautifully. She does it with both science and emotion and spirituality. And she just does this beautiful job. She was actually our midwife. And that's why Sarah is on the podcast with us today, because we got to work with Monika ourselves. And I said, you know what, this is perfect. Monika's going to be on. Let's bring Sarah on too and see what kind of conversations arise. So Monika, thank you so much for joining us today.
Well, thank you for having me. And it's been such a pleasure to see you all again and reconnect. It's been a minute that we hung out, but it was like coming home. And thank you for this amazing introduction. I'm already emotional. Thank you.
Absolutely. Well, it's easy. And like I said, there's so much more that we could say about you. You're seriously one of our favorite people. So how long have you been a midwife now?
So I have been a midwife, licensed for 13 years, but with training 16 years. It took 3 years to train. And before that, I was 8 years a doula. And this is sort of what I'm most proud of. I have spent 23 years in Austin, Texas, just helping women have babies. I've done nothing but that, just hold the space for women to have babies, whether it was in the hospital or out of the hospital.
Yeah. And then you also had some training in Germany, right?
Yes. I'm born and raised in Germany, and I became a pediatric oncology nurse over there. And I did 3 years of training as a pediatric nurse and was able to spend a lot of time caring for littles over there. And then after I graduated, I fulfilled the dream of being an oncology nurse for kids with cancer. And that was also a huge calling.
Yeah. Well, I know that was something that attracted Sarah and myself to you, was you had this beautiful combination of this really great medical scientific background coupled with this other side of, spirituality and just intuition and whatnot, right, Sarah? I mean, that was a big thing that drew you to Monika, right?
Yeah, the perfect combination of holistic and medicine, which I think is so important when you're having a baby outside of a hospital. You need that education, and it was very comforting for us.
Absolutely. So let's just first talk about your book. Okay, so you wrote this book.
Yes.
And it's called Why Choose Home Birth. And you wrote this how long ago?
So this is a really fun story in the way it was published in 2019, and I wrote it in 2018. And I wrote it alongside when I was rebranding, and it really helped me it was really a labor of love, because I had been in group practices as a midwife. So I spent about 7 years as a home birth midwife, being mentored by midwives who were 20 years my senior, which I call my prolonged residency, which personally was critical for me to stay in this field, to have the longevity I have. And the midwives kept retiring on me. And then I was like, okay, now I'm ready. I have this confidence to be in solo practice. What that means is for the last 6 years, I've been in solo practice. And that means I am the one who does all the prenatal care, who does all the birth, who does all the postpartum. Now I have people who stand behind me and help me. I always have a student who works alongside me and partners with me. But it took me all this time to sort of find the confidence in my skills to step out and be on my own. Mm-hmm. And alongside that, I had to rediscover who I am as a midwife. And so I wrote the book alongside that time frame where I rebranded as a solo midwife. And then it was published in May 2019. And I was able to take it to a conference. And this is a really fun story. I had a booth there for only one day. And I was like, I don't know how many books I'll sell. I have no idea. And I'm like, well, I'll bring 100 and I'll put them in a suitcase. And I hauled the suitcase into this conference, and I'm like, "This is so funny. No one will buy this book." I'm like, I have a suitcase full of books, and yeah, we sold out within hours, and awesome. And that was like mind blowing. And I never really marketed the book a whole lot, but what it did for me and writing for me is a spiritual experience, and it was such a joy to write it, and it was such a joy to bring it to the world. And one of the most fun thing that happens once a year is where women find the book and they're like, who is this person and where does she work? And they're like, she is right here in Austin. I could hire her. And they contact me and they go, I've read your book and you're in this town and I would love to meet. And that's always a beautiful thing when we connect, and then we do the whole journey of the pregnancy, birth, and postpartum. So yeah, it's an easy read. You read it within a few hours. I wrote it also for the very, very hesitant partners, which is a beautiful thing that shifted. Mm-hmm. I remember for you all, it was always so beautiful. Brandon, you were so on board for the home birth, which is so, at the time, was so rare. It was always the partner was so hesitant. And then the partner was always like, oh, we need to, not have a home birth. And then the women were swayed. And I was like, I'm tired of that. And that's partially why I wrote the book. I'm like, this is for the hesitant partner. Or it was also about the hesitant family members. It was like, my mom is terrified. I won't even tell her. Everybody's so terrified. I'm like, have them read this book. And I can't tell you how many times I walked in the end, during the birth or postpartum and people just hugged me and they said, your book made all the difference in the world. And so that's what brings me joy about writing this book.
Yeah, no, that's amazing. Well, so Sarah, you're a mom. You've had some home births. Why did you choose home birth?
Well, when Brandon, you were in chiropractic school, and we actually watched The Business of Being Born, which was a documentary that came out with Ricky Lake and somebody else. And I was just captured by home birth. Actually, it started whenever I was in middle school. I would watch A Wedding Story and A Baby Story. And a chiropractor and his wife had a home birth. And I was like, this is the most beautiful thing I've ever seen. Why would I ever have a baby in a hospital with all these sick people? And for me, I don't want anyone touching my baby. After it's born, I want you to leave me alone. Unless there's an emergency, I want you to leave me alone, leave my baby alone, and just give us our space. And that's what I always tell women. That's the most beautiful thing about a home birth is, yes, write your birth plan, but your midwife has your back, or your midwife should have your back if you chose the right one. She's going to honor you and know your wishes. And most of those things in my birth plan were already just your normal workflow anyways. So that was one of the main reasons we had a home birth. And so great that you had this book. I remember we watched The Business of Being Born with my parents before our first baby, because I was like, I want y'all to see why I'm choosing this. What's the education behind this? What is my reasoning? But this book is just a great thing to add to that as well.
Thank you.
But you're right. I mean, a lot of times when I'm speaking with people, you know, they're like, oh, the wife will be like, I want to have a home birth. And the husband's like, absolutely not. It's not safe. You know what I mean?
Or they think it's going to be like a murder scene or
Like a
blood
bloodbath,
everywhere.
yeah.
I'm like, you don't realize blood doesn't come till like after baby comes out. You're not even looking at the blood. You're looking at the baby.
It's always so fascinating to me how they throw the two things together, which as far as value holds, they're not even in the same category, right? It's like, of course, you know, you're worried about your wife's safety, your baby's safety, and somehow we get through that, and then they say the mess, and I'm like, the mess, that is not even like, that's not even like something we should even think about or talk about. Why would that ever keep you, you know? And I don't know where that came from. And there is not much mess. There's one tall kitchen trash bag of mess, and that's it. And I always like to say, we leave the house the way we found it, except baby in arms. So there goes the mess discussion. The safety discussion is a little longer.
I know where you're going.
Yeah, we had one stain on our carpet from, I think, when Gavin pooped, like a few minutes after he came out. Unfortunately, it was a rent house. We're not still there. But I loved that little spot. I mean, you would have never known. You would have thought it was like a little bitty dot. But I was like, oh.
I thought she was going to cut out the carpet and take it.
No, he would always play there in our bedroom. I'm like, you knew where you were born, right here in a full squat. This is where you were born. Yeah, it was beautiful. So I liked my mess.
All right.
Well, so we've mentioned the term like spiritual and emotional and all these things. Can you give me, because you've been in what, 700, 1,000 births? I mean, a lot.
Yeah.
Can you describe just like the feeling, the spirituality, the just what does it feel like? What do you experience when you go to a home birth? And is it really that different, or are they all very similar?
Oh, that is I'm getting chills. That's sort of a bit of a loaded question. Every birth is different. Every birth is different. And, sure, there's things that are very, very similar, but the birth ebbs and flows with the energy and the dynamic of the home. And that's why I do home birth and not births in the birth, because that already cuts into that. However, births in the births are amazing as well. But so it's the energy I encounter in the home. I can, I'm personally someone who is very spiritually wide open, and every birth is different in regard, because every mother and every father, predominantly the mother, has her own journey, and the journey is a lot like, how deep do you want to go? How deep do you want to open yourself up to this experience, And I just told a mom yesterday, we just had her third baby, and she was so surprised that baby number 2, I was there. We walked in 45 minutes later, baby in arms. She expected that. And this go around, it was 4 or 5 hours. It took longer. And there was no reason, there was no physical reason. It could have gone in 45 minutes, but it was different for her this time. And we're a week and a half post-birth, and she was kind of very emotional about it in a joyful way. And what I saw and what I witnessed is really a transformation. And that's why I hold this space as home birth midwife, is that women, they transform themselves into a mother, into a wife, and then there's so much healing that occurs. And some women go there and some women don't go there. So every woman, no matter how old, when she gives birth, she brings a whole lifetime with her. She brings her childhood, her family of origin, her relationships, and she brings all of that into the birth space. And some women, they go very, very deep, because there's healing to be done, and they're willing to go there and they're able to go there. And some women don't. They stay on the surface, and it still works, and that's okay. And this mom I talked to yesterday, she did not understand my words yet, but I told her, I said, you went very deep. There was a lot you had to process. There was a portal that was opened. And as you keep journeying through life, you will continue to walk through that portal, and you will learn, and you will know why it took longer, and why it was so much harder on you, and why it was so much more challenging. It was, you started a healing process, and life will tell you where you go from here. And I know that's all very, very deep, but that's the work I'm doing now. You know, that's where I'm at now. With that's to me why I hold the space as a home birth midwife, and then all the other apparent reasons we can talk more.
Well, I think that what you just described, I think everyone should understand why it's so important to really, really take the time to properly choose who they birth with.
Yes.
Because what you just described, I don't meet very many people in the medical space, especially when it comes to whether it's midwives or OBs. I know some OBs that really understand that, right? Because you're right, like birth can be extremely healing unless you don't let it be, or unless you're in an environment that doesn't promote it and actually fires the sympathetics and actually has the person in a fight or flight response, right?
Yeah. Yes.
What do you think, Sarah? I mean, we know that birth can be healing, and what are your thoughts on this?
Well, I guess our birthdays were always, I say, in our marriage. So Brandon and I have known each other for a long time. Been together since I was 15. He was my first kiss. We were married at 20. But the day of our birth of our children have been my favorite day of our marriage. Like, working together, and you never left my side. You never took a nap. You never paused for yourself. He was with me. And I remember we were young. I was 23 when I had Nolan, and we did a birthing coach, the Bradley method, with one of my favorite Bradley instructors. And I wanted her to be a doula at my birth. And she was like, I'll be there, but you don't need me. She was like, you don't need me. I can see the connection with you and Brandon, and he is who you need. And I tell people that, I'm like, yes, he was who I needed, but something about a woman's eyes in your own eyes when you're pushing the baby, or once transition hits, like he was my support. But I remember like looking into one of the midwife assistants' eyes the entire time, and I could not push without her strength there. So there is something to be said about, you know, I think the history of midwives and women at birth is so important, and being surrounded by strong, supportive women. So you were, of course, there with me the entire time, but there is something to be said about that, and having women surrounding you as well. Is a huge thing. And having witnessed many births, I've documented about 30 births over the years, and it's amazing to be at the birth and the oxytocin flow after a baby comes. Those women I have so much connection with. Yes. And I tell that like it's a friendship, but it's like a sisterhood and a bond. And one of our OT, Kristen, I documented all 3 of her home births, and just that bond and connection you have with them for forever. So you shared that with so many of these women. It is amazing.
So you brought up transition. Transition's fun. Obviously, I've really just witnessed yours, but obviously there's going to be listeners that don't understand what transition is. Do you want to open up the can of worms here?
Yeah. So birth, the birth follows sort of a rhythm, and it's like your body and your baby work together, and your mind works together. I'm sure your sympathetic, parasympathetic nervous system works together in it. It's this dance where women start contracting. They start in an early labor phase, and the body is sort of testing out the waters. How does baby like contractions? How is mom tolerating it? It's this very intricate dance. And as time goes on, we get into what's called an active labor phase. That's when the women have learned and accepted that, okay, I can handle this intensity, and I can move forward. And then we're moving forward. It gets a little bit harder, and a more intensified experience. And that's when the midwife team comes to your home and helps you, because the intensity comes. The baby needs to be monitored to see that baby is okay with the intensity. And then that accumulates into this transition phase. And we didn't really even talk numbers. So in the medical community, we call up to 6 centimeters of cervical dilation is called early labor. After 6 centimeters, it's called active labor. And then around 8-9 centimeters of cervical dilation is called transition. And these numbers are present, but there's so much more there that goes way beyond these numbers. And one of my pet peeves, of course, is it goes way beyond cervical dilation. It goes about, is the baby coming into the pelvis? How's the mom tolerating things? How is baby tolerating things? How are the tissues stretching? It's a very intricate process. and everybody gets stuck on dilation, but it goes way beyond. But transition is really where mothers move into the very heightened intensity of labor. It's a shorter phase, but it's the most intense part of labor. And the contractions are very, very frequent, back to back. Also, the sensation of the baby descending is present. And so many things women have not felt in their body. It's overwhelming, right, Sarah?
Yes, overwhelming. Not pain, because you cannot quantify that.
Yes.
But the most overwhelming experience of your life, for sure.
Yeah, and nothing really prepares you for it, right?
No.
Yeah.
Yeah, I just remember,
transition.
Everything's going along and she's pushing, whatever, moving around, getting comfortable, whatever. And then all of a sudden it's like, whoa, she just changed.
Well, and I remember we actually have it on video. I look at Brandon, and I'm in the birth tub, and I say, nobody can help me. And he has a tear that rolls down his face, and he's like, you are the only person who can do this, but we are all here to help you. And I've noticed this as I witness births. It's the moment of surrender. Because I feel like in my own experience, until then, you almost fight it. But then you realize you have to surrender. It's the only pain that you meet and you can't run from, and you have to push through it, and you have to surrender your body and surrender the moment. And it's just, it's a lot, but it's beautiful. Beautiful.
Yeah, that is truly that transition, and that's why it is called transition. It's what makes you a mom. It's where you have to really dig deep, and it is some women can wing it until then. They stay in the present moment. They chat. But once that moment hits, and you just gotta go deep. And I love how you said you witnessed this. This is very beautiful. Only the woman, the birthing woman, can do it. No one can do the work for you ever. And that's the beautiful thing. And I will sometimes look at women. I recognize that, and I will say, you feel very alone right now, but we're all here sending you love. And I will always say, think you have enough strength, you have enough courage, you are brave enough. I put my hand over their heart and I tell them they are enough in that moment, because it feels like maybe I can't do it. That's a classic term. When women say, I can't do it, I'm like, oh, she's in transition now.
I have that quoted in the birth, the notes. Sarah says, I can't do this, or I don't like this. But yeah, I also feel like a woman pulls the energy from everyone in the room.
Absolutely.
So it doesn't matter if you're at a birth for 2 hours or 20 hours, somehow you leave absolutely drained and exhausted. But you have to pull that energy from everyone in the room, which is why it's important to have people of similar energy in your birthing space.
Absolutely. Yes.
So what do you think? Okay. It's important to surrender in this moment. So why not just get an epidural and wipe all these feelings away?
For some women, that's what they need. That's what their body needs. That's how they want to go through this process. Again, they're not, this is the type of birth they want, and that's perfectly fine. For some women, that is the way to go. For me, I also birthed my children at home, and I hold the space as a home birth midwife, because to me, this is the moment where the portal is open. This is where you become so much deeper in tune with yourself. And this, to me, is the moment where you become a mother. This is where you move through this hardship, or through this difficult thing, and then comes the joy. This is the human experience. Birth encompasses all of the human experience in this one moment of labor, birth, and that's why I love it so much, because I get to see the rawness and the honesty, and and that's what people choose, and that's a beautiful thing. And if you are willing to go there, it will make you a better mother. It will help you on this life journey. You know, it will help you. And I'm not saying that women who choose hospital births and women who get an epidural from 2 centimeters, they're not good mothers. I want to be very, very, very clear about that. It's the difference of some people journey in their human experience through life where they're very comfortable on that sort of surfacey, worldly experience, they're very comfortable. But some people, they're like, I want to have a spiritual experience as this human being, and I want to journey. I want to process my childhood. I want to do therapy. I want to be connected to a church. I really want to work on my the spiritual part of me, and home birth is that extension of that, and that's just another way to give birth, to go through your human experience, and it opens up those portals.
That's really beautiful. It really is. So maybe to flip over into a little bit more scientific of a discussion, do you think that there is a difference in developmental trajectory in the newborn? And we can talk about this in a couple of different ways, because I was really going to mainly focus on the newborn, but you brought in a whole nother subset of a discussion where this not only sets in motion a developmental trajectory for the newborn, but you're right, it also does the same thing for the mom and for the family as a whole.
Yes.
Because that mom just went through an incredible experience that changes so much about them.
Yes.
Their dopaminergic systems, their oxytocin, their prefrontal cortex or limbic system, all of these things now just got this rewiring.
Yes.
So we can go in either direction, but with the newborn, have you seen, or what would the discussion look like if we were to talk about newborn via home birth versus the typical medical hospital birth?
Yeah, I want to be very careful, because you can really sort of open up a can of worms there, which I really don't want to open up. All women love their children, and they're bonded to their children. But what I want to say is what I have seen is what I have witnessed over the years, and I cannot eloquently explain it like you with the neuroscience, but what I have seen is overwhelmingly, and this may be bad news since I just helped one of your employees, is that they plan to return to work. They got a whole life, they're not.
We've already talked about that.
And so what I've seen overwhelmingly, and early in my career, that was probably the first things I witnessed, was that women were like, I take my 6-week leave, I'm going back to work. And I'm like, okay. And me being from Germany, that always was like very fascinating, how would you leave your newborn like that? And
we give 3 months, by the way.
Great.
3 months paid.
Full
Good.
paid, yeah.
Wonderful.
Just
But
FYI.
still, we know sometimes it's not enough, and we have discussed that.
Yes.
Right.
And so what I'm overwhelmingly seeing is these women, when I meet them again down the road, because they went through this experience, that they ended up saying they're so bonded to the baby. And that they say, I made adjustments. They figure it out, right? We live in a world, we need the 2 incomes and so forth, but they're like, I figured it out. I'm working X amount of hours. They just have this bond, and there was something turned on innately where they say, I must be with my baby. And on the other side, and this is also extremely controversial, they have this beautiful nursery. I always love when I have a good laugh when I see it. I'm like, beautiful nursery. And I don't really redirect women, because I want to find their own power. And then they have, and we always ask, what is your plans with sleeping with baby? And they're like, oh, we got this bassinet on the other side of the room. Okay, great. And then we get there a few days later, they're like, that's too far. My we've moved it next to the bed. That's too far. They're like, my baby has to be with me. So there's this bond, this overwhelming bond. They're intensely bonded with their children.
Yeah. Well, yes. And that's extremely important to understand. I was just talking about dopamine, oxytocin.
Yeah.
I mean, a lot of the pain that someone goes through, right? You have this pain, pleasure, balance.
Yes.
So if you get this intense pain, what will follow has to be, neurophysiologically, has to be an equal amount of pleasure. And so you get this dopamine, oxytocin, noradrenaline. I mean, you get this massive neurochemical cascade. So if you go through that, You experience this pain. You get the complete opposite, this ginormous bonding experience, which is exactly what you just described. And then, of course, you want to co-regulate. I mean, when that baby is born, just normal standard neurophysiology states, that baby needs help regulating. It needs to co-regulate. It needs, to hear mom breathing, hear mom's heartbeat, etc. That baby was just in you, listening to your heart rate, regulating off of the heart rate in your voice and all of these things. And then all of a sudden, just to rip it away is a little bit frightening for the child.
Yeah.
And nor is it safe, like biologically, through the centuries before us.
Right.
That baby wasn't safe anywhere else but on mom's chest.
Right. And again, I totally acknowledge, people out there, everyone has a different scenario. Mm-hmm. And this, honestly, I used to be very black and white about this, but I was able to speak with a social worker, mm-hmm. right? And so the social worker was like, Brandon, you don't understand. There are people out there that are meth heads and they get pregnant. Mm-hmm. You don't want that mom sleeping with a baby in bed.
Yes.
Mm-hmm. You don't even want that mom breastfeeding.
Yes.
So mm-hmm. there are instances out there where mm-hmm. There's mm-hmm. things that need to happen, but
right.
So we understand that. And then of course, mm-hmm. you're right. This is a full life experience and there's traumas mm-hmm. that may come up.
Yes.
That may prevent some of this bonding that mom needs to work through.
Yeah.
Or that comes up that may prevent like a labor accelerating how it normally would.
Yes.
And maybe you don't talk through that, but hopefully internally mm-hmm. the woman is dealing with it.
Mm-hmm.
Yeah. Which is a really deep conversation.
Mm-hmm. Yeah. Yeah. So, I would like to say that my assumption is that it's an assumption, it's an observation on my end but I do from time to time see absolutely women going through this trauma release. I just recently saw it a few days ago, and it was tremendous trauma release. And thereafter, the mom had a difficult time bonding and being with the baby because it was very overwhelming, and it was very clear to everybody in the room. And we just keep holding that space. And we just let her sort of come back to herself and her body, but she went through a tremendous amount of healing. And interestingly enough, her cousin was there, and I pulled her cousin out of the space and I said, you may know more of her history, but do you realize we just witnessed this tremendous release of neurological release, because she kept having this sort of neurologic shaking, not the pregnancy kind of shaking we see in the birth, but it was this neurological kind of shaking where we release something, like we're startled, mm-hmm. right? She kept having sort of almost a startle reflex, and I'm like, we witnessed something very big here, and she said, well, yes, we know, and so I said, just stay in conversation with her over mm-hmm. time. Yeah. So Wow.
Mm-hmm. So a lot of this stuff can sound pretty scary for people listening, right? Mm-hmm. Maybe there's some people that have not had kids. They're still trying to, figure this stuff out. Mm-hmm. But what I want to start the discussion of right now is safety. So can you walk us through statistics or however mm-hmm. you want to do mm-hmm. this? And I know that mm-hmm. you are going to, as a midwife, mm-hmm. qualify your patients, right? Mm-hmm. Can you just kind of give us mm-hmm. some idea about what that looks like and how safe this actually is? Absolutely.
So I always like to start with my own statistics. Obviously I come across, I'm spiritual, and what we're talking today is somehow we ended more on the spiritual, emotional side of birth. But I find a lot of peace in numbers. Numbers are very grounding. I live my world with the birth in sort of the gray zone, and you have to be comfortable. Nothing is very black and white. But numbers don't lie. And so I do want to give you my own statistics. My own statistics are, in the 13 years I have been licensed, is that I have never lost a mom. I have never lost a baby. I have only had about a handful of NICU babies, but those weren't even babies where I transferred the mom to the hospital. And it was emergency C-section or anything. Those were babies where we were like, it's not working at home, we need help in the hospital. And then many hours later, the baby ended up in the NICU. So So that's my statistics that's pretty impressive statistics. And as far as otherwise, my statistics are as follows. If 100 women come to me, 92 will deliver at home. So that's a pretty high rate. For a while there, I worked very closely with an MFM, which was very beloved in his town. And he always lectured the midwives and said, look, if you don't have an 8 to 12 transfer rate, we call it transferring out of our care as midwife, then you're not practicing midwifery safely. And in Austin, Texas, we're very fortunate. We have wonderful transfer hospitals. So it's easy to transfer because my clients will not be ridiculed. So my transfer rate, depending on the year, is anywhere from 8 to 12%. And it highly depends on who do I take on as a client. So a mom who has had a vaginal birth, whether it's hospital, home, or birth center, who comes to me has close to 100% chance of delivering at home with me uneventful. Now, I'm not making this up. This is my personal statistics, okay? And then we take on the moms who've had a prior cesarean. And then that we don't know how that's going to play out. And that is very important to keep that mom safe. That's called a VBAC, a vaginal birth after cesarean. And we're doing a trial of labor. And I've been very fortunate this year. All my vaginal birth after cesarean have been at home. But some years we transfer those more than others because it's all about safety with that. If something doesn't unfold physiologic and we can't sort of help it, then we have to go to the hospital. And so if I take on a lot of VBACs, I transfer more, if that makes sense. And then the transfer of the first-time mom. So first-time moms, they're sort of the great unknown. They've never given birth. They have a heart's desire. Their accumulated life experience has led them to wanting a home birth, which we have seen a tremendous shift since 2020. We're getting so many first-time moms now, which is a beautiful thing. And it's an extension of the lifestyle they have been living. And we just have to see how are they tolerating labor? How are things going? We don't have a history on them. And those are the majority of my transfers after they have been in labor for about 2 days. Then we just need help. They're non-emergent. We just need help. So when I talk about, let's say, the 10% of transfers I have, they're my first-time moms. And they are my VBACs, and that's about it. Yeah.
I mean, it made sense for us. I know, we're pretty linear, logical, analytical thinking people, Sarah and I. So when we approach something, we never are like, oh, we're doing a home birth because that's the holistic way and that's what we're going to do, period. We're the same. We like to look at statistics and we like to really analyze the situation. Sarah's healthy. I'm healthy. We didn't have any major, issues to work through, right? And so just statistically, it made sense to have a home birth, right? I mean, do you want to elaborate on that at all?
Well, I think there's statistics out there that say low risk moms that are healthy, right, actually are safer having a baby outside of a hospital than they are inside of a hospital because of all the cascade of things, interventions that can happen in a hospital. Not downplaying the importance of medical care and all that, but I loved that Monika and Deborah, they had us go see for our ultrasound at 19 weeks. We went to a neonatologist. We didn't just go to the strip center, sonogram person. How important it is to have a very skilled physician review your ultrasound and look at all the issues that can happen. That was one of my big, the huge comforting thing for me to know that we were safe to have baby at home because of that.
Dr. Barry, he's a perinatologist.
Yeah, he is. Yeah, so he is a maternal fetal specialist, and he has retired now. He's an MFM. And, big shout out to him. He helped grow this community tremendously by being supportive of home birth. And I want to kind of circle back a little bit because I didn't fully answer your question. So one of the things we do, and you touched on that, Sarah, is with home birth, is we do risk assessment. So whenever someone is called risk assessment, so when we do a home birth, we take a calculated risk. It's like, okay, we're doing a calculated risk. You have a a professional there who know what they're doing. They're supervising the birth and labor and birth. And then and that makes home birth safe. Okay. And so when someone is contacting me, the first thing I find out is, do you have any chronic illnesses? Do you have any, if people have chronic illnesses, let's say, for instance, if someone has diabetes, type 1 diabetes, they're not a good home birth candidate. There's just some medical conditions where it doesn't make sense. They need the supervision in the hospital. Mm-hmm. But so we always do a quick risk assessment. Do you have high blood pressure? And then a lot of people think like, well, chronic illnesses, I mean like major illnesses. I'm not talking you're eating gluten-free because you have gluten sensitivity or something like that. Right. Nothing like that. Or a lot of people are confused about Hashimoto or thyroid. At any given time, I have people who have Hashimoto or thyroid illness. So, but we do a risk assessment, and then we continue the whole pregnancy and during the birth to assess the mom's health and the baby's health. And if all looks really well, and we just keep on going, and that's a huge part that keeps home birth safe. The mom's blood pressure has to be normal. The baby has to be growing and thriving. And then along the way, we do labs and we see, how is mom doing? How is mom thriving? Mm-hmm. And then you mentioned what we call the anatomy survey. It's an ultrasound. That also is a huge indicator of like, is it a smart idea to have a home birth? Is the baby healthy? And all those things are helpful, guide us.
Well, and that's something that is the awesome thing about seeing a midwife in private practice is you meet with this midwife for at least an hour once a month, and then every other week, and then every week. How many times do you get to see your OB for an hour multiple times in your birth? Right. So she's getting to know you. She's getting to know your emotional, your physical, how you're doing, and she can read you. So in that labor, when something comes up and you can see it in their eyes because you formed a relationship with them, right? Like that's a big deal. I remember a midwife once said, like, I don't have emergency transfers. I know, you notice those things. Yeah. That's why your emergency transfer rate is nil to none, is because you're constantly monitoring in that labor. Yes. Constantly. Yes. And that's just one of the amazing things. And that's why you fall in love with your midwife. It's because not only do you have that oxytocin love, but you really form a bond and a relationship with them through your pregnancy.
Yeah. I remember we read one of Ina McGaskin's books. I forget which one, but she had an example in there of home birth to hospital birth. And it said, imagine sitting in a bathroom with lights blaring all over you, with multiple people around you. You have no idea who they are, coming in and out of the room, and you're trying to have a bowel movement. Imagine that scenario, right? Because it's similar muscles, it's similar actions, all these kinds of things. There is something to speak about the environment and the people around you when you're birthing, right?
Absolutely.
And I think that needs to hold some credence, right? I think that people need to understand the neurology behind that, right? I mean, we're talking about, we're sitting under glaring lights right here, just having a conversation, and it's a little overstimulating.
Right.
Imagine being naked and people looking all over you, and you don't know these people, and they have rubber gloves on, and it's challenging, and especially if you've never been in that scenario, to then just tell your body to let go and have a baby versus you're in your own space. The lights are how you want them. The temperature is how you want it. You have the people in your home that you want in your home. It's a completely different environment.
Yes.
And that's important to understand.
Yes. And also, Ina May that you just quoted, she said the first intervention is leaving your home. And that is the first intervention of a normal physiologic labor birth. And people do come to me where they say they had maybe a hospital birth and it didn't go the way they were hoping to. And it's overwhelming. They say, I was doing so good at home. I was doing so good, and I could handle the contraction, and I loved being at home. And as soon as we got to the hospital, everything just stopped, and it just didn't work anymore, and so we know that's well reported. When I was a doula for 8 years, Toward the end of my career, I sort of kept pushing the envelope a little bit, as many doulas do. I kept them home longer and longer and longer, and, laboring with them at home because they were doing so great. And then as soon as we got to the hospital, everybody was so happy how far they were dilated, how far mother was in the process. But it all just paused. It just didn't continue. Mm-hmm. That was a huge learning curve ahead as a doula.
Right.
Yeah.
Well, I think it's also important to understand, one birth that we were just speaking about not that long ago. We love how you educate your mom and let them make the decision.
Yeah. Yeah.
And even though there was a scenario where, you didn't typically do this type of procedure, you'd only done it like twice in your entire career. Mm-hmm. You didn't make the decision for them. You said, hey, here's your options.
Yeah.
This is how this can go. This is how this can go. What would you like to do? Mm-hmm. Mm-hmm. Because we know other midwives that would not have approached it like that, and how important that is. Mm-hmm. So you truly honor your mom. You truly honor your families, and let them make the decision, which is huge.
Yeah. Yeah, you're bringing up something very, very important that has been a pet peeve in the journey of mine a bit. A couple of things I want to go back to what Sarah said. So I do average 14 visits. All my clients, every time I look back when I file the birth certificate, 12 to 14 visits. Guys, that's at least 16 hours I spend with them. Full, like no shortcuts. And sometimes in the end, when we see each other, like, weekly, it's like there's nothing more to say. I'm like, you get my full attention. How are the kids? Mm-hmm. How's the husband? And there's always something we find. Some clients of mine are like, this is like therapy. I'm going to miss you so much. Mm-hmm. Some clients come up with excuses to just keep checking in with me, which is beautiful. And so it's in the book, the cornerstone of midwifery is building that relationship. Mm-hmm. This is when I said 6 years ago out to be a solo practice midwife. My practice was highly elevated because it was just me doing the work. And then also what you're bringing up, Brandon, is it's called informed consent. And midwives as providers are not immune to practice coercion with their clients. Like in the hospital, there is a decent amount of coercion. Like, if we only do that, then we get you here. Or, things like, you'll meet your baby faster if we do this intervention, or you're going to die if we don't do this. That's an example of coercion. And midwives are non-immune to practicing coercion. But to me, I always knew that the relationship I've built with my clients, they trust me, I trust them. I have to also trust them. And that this is a powerful relationship. You said it repeatedly, Sarah, all that oxytocin, all that bond, also as the midwife, you hold sort of power walking into that birth space. She trusts you now, and you hold a lot of power. And midwives are not immune to abuse that power. Mm-hmm. We are human beings. We bring a whole lifetime to this experience as well, to being midwives. And so I have always been very, very careful and very, very critical of myself. And I will not work like this. Because this is how you can really hurt and traumatize people, very much so. Because to be injured, like emotionally hurt and injured by someone you don't trust is one thing, but by someone you trust is a whole nother thing. So I practice informed consent to the truest word of it, where you truly, truly give people a choice. You lay it all out and you let them decide what feels right in their body. And I practice that as much as possible. And I do tell my clients, short of a true emergency, which for us is generally the hemorrhage or working on a baby. Hemorrhage means she's bleeding too much after birth. I will always talk everything through with you. I will always give you a choice. I will always have you answer your question. And I will always leave the room so you can talk through it and make that decision. And that is critical to me because, and then people feel they feel empowered, not my favorite word, but I haven't come up with a better one, but they feel like they have a sense of, they learn to trust themselves in their decision making, you know, and that's important.
Yeah.
It's very important. Another thing that we often talk about is the use of Pitocin post-birth to help with bleeding.
Yes.
I think it's something that if someone doesn't fully understand the benefit, when to use it, when not to use it, etc., I think it is one of those situations where they can take this dogmatic stance of I'm not going to use drugs, I'm not going to do anything, right? But you can, you're going to be way more educated in this than I am. I just have seen so many moms come, because I used to see a lot of post-birth. I was, a big pediatric chiro back in the day. I mean, obviously I still specialize in peds, but more functional neurology. But you see that mom walk in full of life. They have blood in their face. They, they're in it, and like, okay, they didn't bleed much after birth versus the mom that comes in, no color, no energy, they're breathing heavy. Like, Can you walk through like maybe why someone should consider that? I mean, and Sarah had some after Gavin.
Yeah, so after both. After both boys, we had with Nolan. They just gave me a shot in my thigh afterwards, and we had talked to Deborah, and we told her, we were like, hey, if you have any reason to think I need this, give it to me.
And it was post-birth, just to make sure everyone understands this is after having the baby.
And it's such a low amount. It is not like the cascade of Pitocin you have before birth. So let's explain that.
Yeah, you're not realizing, you don't know this, but you're doing a beautiful job. There is a lot of misinformation out there right now about Pitocin, so it's very fascinating you bringing that up. So basically, midwives, what makes us safe is we can use emergency medications after birth, and that's critical. Brandon mentioned that. We are not allowed to use medication for like hemorrhage or any helping with contractions until the baby is born. Very important. And if we have something called standing orders, so I have a physician who gives me standing orders, and therefore I am allowed to use certain medications. And my most important medications are to stop a bleeding, because that is the number one thing we run into. If we run into anything, I mean, it's the slow labor for the first time mom, and then the sort of emergent thing, it could be the bleeding post-birth. And we know risk factors, and we know certain things that, like, we screen the mom along the pregnancy. It's like when a mom comes in and she says, look, every time after birth I bleed. I'm like, well, how do you feel about, we call it third stage management. We'll give you some Pitocin. And she's like, yes, please. She's very well educated. And then if no one, and then there's things like we do know from experience, is also documented in the literature, that if a mom has a very large baby combined with either a very slow birth and very large in my world is about 10 pounds up, 9.5 to 10 pounds up. That's a big baby. My average size baby is about 8.5. Which the physicians think is big, but that's my average size baby, that whether my mom is 5 feet or 6 feet, they push that baby out, no problem. But if we know the baby's on the bigger side and it's a very slow birth or a very, very fast birth, we know that the uterus is tired. We know that likely there is bleeding. And I still take a wait and see approach. I work a lot with herbs these days, and I have been very, very successful in avoiding bleeding. But as soon as there is a bleed, I am going to move to Pitocin or Cytotec. Those are medications that help us, and it goes I have had this I've said this for forever. What you were talking about, Brandon. If I have a mom who is on even her second baby, third baby, fourth baby, fifth baby, and the more babies you have, there is an increase in potential bleeding. And if that mom starts hemorrhaging on me and I don't sort of help her immediately, she's going to have a very challenging recovery. And I'm like, she has 2, 3 other kids to take care of. Why would I let her bleed too much and then feel horrible? And so I have shifted. I used to give more Pitocin in my earlier years. I found herbs that are very, very effective. So I will go to herbs first. But then when there is truly that extra gush, or I'm not comfortable with what I'm seeing, I immediately go to the medication. And then the moms are always grateful and they recover very well. There is this current understanding that's out there is that if we give Pitocin, I have clients walk in, especially first-time parents, saying, don't give me Pitocin because it impedes with the golden hour. It keeps me from bonding with my baby. And I do not know where this is coming from. I didn't even deem it worthy to do a lot of research on this because I'm like, if you bleed too much and you can bond, then you can bond. You cannot bond with your baby either.
You can't even make milk. Like if you bleed too much, you're going to have a really hard time getting your milk in.
And let's talk about Pitocin. It has a 15-minute half-life. It's not keeping you from bonding with your baby. It's not my experience at all.
Yeah. Well, and it's a small dose, like compared to what you have for 12 hours while you're laboring.
Yes.
Exactly. From an herbal perspective, are you using like cohoshes?
It's called placenta ease, and it's a wonderful herb. It's a mixture of herbs, and we just put it on the mom's tongue once baby is born. And I use very little Pitocin. I just use placenta ease, and I would use placenta ease on you, Sarah.
That's awesome.
I wouldn't be worried.
Helichrysum.
Yeah, and I still actually found silver stitch, the plant, and I have it planted. And I guess from that oxytocin flow and the smell of helichrysum on me, it is my favorite essential oil. It like makes me so happy. I like go out there and brush it and smell it all the time.
I don't know.
So wonderful.
Have you heard of helichrysum as far as like it's very powerful. It's an essential oil. It's an herb. But I remember... So Sarah's mom cut her finger and it would not stop bleeding.
Okay.
Would not stop bleeding.
Okay.
And she takes aspirin for a certain condition.
Yeah.
And so we're like, hey, well, we have helichrysum and supposedly it stops bleeding. We put it on there. It immediately stopped the bleeding.
Beautiful.
Yeah. So in the birth world, they say you can rub it on the back. Like I remember they said rub it on her back before, but anyways, some really cool things.
Yeah,
Thank
absolutely. Yes, absolutely.
Well, so that's a really good segue into this concept of, what you're now certified, licensed in, the Functional Diagnostic Nutrition, so that you're now an FDN practitioner as well.
Yes.
Can you give us some insight on what that is?
Yeah, so I just spent about a year for additional training, and it's a beautiful program that allows me to do a lot of functional testing for all body systems. I'm very excited about that because we're not just our gut, we're not just our liver, we're not just our hormones. I'm able to test all body systems and see like where things are out of balance. It's trademarked, we call it metabolic chaos. We don't even are concerned about the one thing, it's called metabolic chaos. And then with stress protocols, diet, rest, exercise, stress reduction, and supplements, we help the person heal. We're just removing stressors, hidden stressors in the hormone, immune, digestion, detoxification, and also neurologic pathways. We're wanting to remove those hidden stressors, and then the body will heal itself. It's generally a 90-day program. And the reason I got this extended training is because I see my very, very healthy moms now come in after, I'm their family midwife. We're on our second, third, fourth baby, and they're just not feeling well. They're not bouncing back as well. They have several issues with their health that they're working through. And I'm like, I think I would like to, I need more tools to help them. And then also what I'm seeing is that clients of mine that never had struggles to conceive, all of a sudden have struggles to conceive. So I want to help them. And so I'm very passionate about helping people before they plan to conceive to be their best self. I'm very passionate about people who struggle with infertility. And I now have the tools to be able to work with people over 90 days to help them rebalance their systems. So I'm very excited about this journey, which is alongside my midwifery journey.
Yeah. Well, I mean, it just makes sense, right? So you already have this demographic you're helping, but they need help in the interim.
Yes.
Whether it's trying to have a new or another baby, like you were saying, infertility, or just trying to recover from life.
Yeah.
And, whatever it is. But do you have like a target? So what is your target demographic then? Is it that person that, like, what is your target demographic?
So my target demographic is I'm starting to work with my clients. My clients are, but I work with everybody, obviously. Anybody who just wants to be, whether you're on your first baby, on your second or your fourth baby, anybody who wants to just really at their best health at conception. That's who I'm working with. And then I'm also working with people who are struggling with infertility. This program has had great success with that. And so that's a target group I'm working with. And then I also want to work with my fellow practitioners, with midwives or anybody who like a midwife or who just like chiropractors, you know it. We can leave it all out there and we forget about ourselves, right? And so I also want to help those people. So yeah, that's sort of my target group.
What about a scenario where you have someone working with an OB or
sure,
and
absolutely.
The OB is like, I don't really do that. I mean, that would be a scenario.
Oh, absolutely. Thank you for bringing that up. Absolutely. Like someone who is really suffering from infertility, they absolutely, they need to stay with their OB and they need to do, if they're like on this fertility journey, but, their fertility specialist isn't telling them, you need to drink clean water. You need to have clean food. Your liver is congested. Let's clean up your liver. You have gut issues. You got bugs. We know there's bugs in your gut that keep you from getting pregnant. Well, let's also look at that way. Let's look at you holistically. Yeah.
So I just see that as a great opportunity because I think, and I know some medical practitioners that are really beginning to open up to this concept of, hey, we have to look at the whole person.
Yeah.
But they have no idea where to go with that, and they have these patients that are suffering. So I would love for whoever's listening, we have a decent medical, community that listens, right? So I would love for whoever you are to be able to share Monika's information because there's patients out there that need your help that are working in the traditional model that need to step out, work with you, and then they can still work with their OB.
Yeah, and why wait 6 months, 2 years down the road when you are not able to conceive a baby? Like your first thought should be, let's get my body fixed. Let's work on this. Let's make it optimal so that when we start trying to conceive, it happens.
Yeah. So what would be some things that you can give, let's say a first time mom and dad, they're thinking about, hey, in a few months, maybe we want to start having a baby, whatever. What are some things that you would say to them to start doing?
Well, so in general, whoever you are, I think the main thing is, very, very simply, just kind of, examine your lifestyle, examine the water you're drinking, which sounds so silly. Are you drinking filtered water? Examine the food in your home. Examine the plug-in filters. What is your chemical load in your home? So those are very, very simple things. And then, so that's when I work with people. And then the biggest one is examine your stress level. Conception and stress do not go hand in hand very well. Examine your sleep pattern. It sounds so simple, but those are very, very critical things that will help you on your journey to get well. It's sometimes we just we change a couple of things, and then they become pregnant. You want to go into pregnancy well nourished. That is very, very critical.
Absolutely. You're right. Sometimes the most simple thing can make a dramatic change in someone's life. I was working with an autistic child not that long ago, maybe 3 months ago. And we were just talking about, this kid was having flare-ups and they would always happen in the kid's room. And, when I got that piece of information, I was like, wait a minute, tell me about the room. They were just whatever. And I was like, there's got to be a 5G tower right outside the window. Well, okay, there wasn't a 5G tower, but the kid's bed was right up against a wall. Yes, there was an outlet. And I was like, what was on the other side of the wall? It was the big electrical panel, right? For the home. Like that's where, and I was like, okay, get a tri-field meter, which you can get those on Amazon now, and measure that kid, how much EMF, non-native EMF exposure that kid's being exposed to. It was like way off the charts where that kid sleeps. Yeah. And the kid would have a meltdown every night before bed, but only if he was sleeping in his room. Isn't that crazy?
It's fascinating.
And so they move the kid out and he doesn't have meltdowns anymore.
Yes.
We are in our home, unfortunately, we did not, we were not aware that the electrical panel was being put in the wall of our master bedroom. And when we walked in, and we almost fell over. So we ran to the hardware store. We got a big
steel, copper, aluminum, and you can only read it over here. It's not over here. Right. But I'm like, oh, what do we do?
Yeah, so we like encased it in like 3 different types of metals. Yeah. Stainless steel, copper, aluminum, like put a bunch of sheets up. Yeah. Because this is real. These are real concerns.
Well, yeah. And one of the big things is just like, just turn your router off at night. All the EMF we're exposed to, all of that. Don't, I have to sleep with my phone next to me, which I keep it like 5 feet on the floor because I'm on call all the time. But if you don't need to sleep with your phone, please keep it outside your bedroom. The bedroom is no place for any of that stuff.
Right. Yep. And you're right. Stress is huge. When I lecture on this, I always tell people, when you're running away from a bear, your body is not trying to make a baby.
Exactly.
And your body doesn't understand the stress response from a bear versus a job you hate. Or versus a stressful marriage versus I have 3 kids at home and they're driving me crazy, right? Those are all a bear coming to attack you.
Yes.
And your body is not as concerned with making a baby in that state.
Exactly.
So important.
It's so important. And at the same time, when people always say, well, what is your advice? we're thinking about conceiving. What is your advice? And I have to admit, the first thing out of my mouth is always have fun. Also, don't overthink it too much. Yes, those are very simple checklists people don't think about that we kind of mentioned, and they're more exhaustive. But I mean, also don't go down a rabbit hole. It's so easy to like, my house has to be perfect. Everything has to be perfect. I need to eat the perfect food. Yes, we want you to live as holistically as possible, but also, have fun with it, and and don't fret about it too much.
Practice makes perfect, right?
Yeah, exactly. Exactly.
Awesome. Yeah. Well, so you do have another book that you're writing, right?
Yes.
What is that book?
So the book doesn't have a title yet, but it's very, very dear to my heart, and it is about miscarriage. And so I tend to be a long gestator when it comes to books, it appears. I outlined this book about 4 years ago. I was very passionate about it, but life gets sort of in the way. But now I feel, midwifery life, raising children, it's all very demanding. But I also believe everything happens for a reason and everything happens at the right time. And so I am very committed now. The outline is still wonderful, and I'm very committed to writing the book. And I'm looking for a publisher. I self-published the first book, but I would love a publisher. Hay House would be my first. So if you're listening, I would love to publish with Hay House. Anyhow, so about miscarriage, my power in writing and my magic in writing is that I'm simplistic in my writing, and I'm just like we're talking right now. That's how my writing is. And so it's very easy for me to reach people, and I believe that's my superpower, and that's why I want to keep writing. And so miscarriage is a part of a woman's life as long as she invites children into her life. And it can be sort of a normal process in a way that the body's very wise and will let go of babies, that if it's just not meant to be, or it can be that there is potential environmental factors or issues that keeps women from conceiving. That's why I also got the additional training, so I can help women on both angles, and I've seen it both ways. But I do think that we lack an understanding around miscarriage, that there's so much misunderstanding in our society. There's so many dumb things that are told to women, and yet it is such a big part. As long, like I said, as long as women invite children into their lives, there is potential of a miscarriage. Every third or fourth woman will have a miscarriage. And I think they deserve to be educated from a science point of view, like what's happening in your body and how can you potentially avoid it, or but also from a spiritual point of view, what's going on. There's a huge belief I have around that. And I have counseled hundreds and hundreds of women through their miscarriages. And the book will also have a part that is often not understood, because we also can have our babies at home in a miscarriage up to a certain point. I've talked a lot of women to having their miscarriages at home. And so that's how the book is lined out at this point, just educating people around this topic, because it's very common, but the education is lacking.
Yeah, there's a huge gap there. Wouldn't you agree?
Yeah, definitely.
I mean, I think that's something that, I'm glad you're bringing it to the table, because you're right. It's a part of life. And I think that when someone does experience that, they tend to just push it down. I don't want to deal with that. It's like any trauma. Yeah.
Yeah.
But there's you need knowledge behind it. There's a grieving process. There's there's things that need to be acknowledged.
Yeah. And that's the idea of the book. And I think the biggest thing I hope to achieve with the book is that what always breaks my heart when a woman calls me and she's realizing this baby, it will not stick, is, she has to let go of this baby, is always the first thing every woman has ever said to me, I'm not kidding, is, what did I do? What did I do? And that just is so heartbreaking, because it is not the woman's fault. It just is not. It is. And so I always work through that. I can't tell you how many women said, I drank that glass of wine 2 weeks ago. Do you think that's what it was? I had that fight with my husband. Do you think that's what it was? And that's just, there's so much myth around there. And that's just, I'm so passionate about it. And to debunk all of that, and to give sort of a handbook for as early as our teenagers to just learn about this. So when they become women and they go into their fertility years, that they have sort of a working understanding of it. And that's truly why I am looking for a publisher, because I believe very strongly this needs to be out there, this information. I believe in the words that will come to me. And I strongly believe I just need marketing power behind me to bring that to the world, you know?
Definitely.
Yeah.
Right. Wow. So how can people get in touch with you? What's the best way?
So you can find me at monikastonemidwife.com, or you can on Instagram or Facebook, you can find me at monikastonemidwife.com. I'm so close to 1,000 followers, which I know is not much in the social world on Instagram. So please like me, follow me. I want to get to 1,000. My work goes all to my clients, and social media is, so marketing, I'm trying. And you can also email me, mail@monikastonemidwife.com. And it's Monika's with a K and Midwife is with an F.
Yes, I was going to say that's very important for people to understand. Monika is Monika, and Stone is Stone. But yeah, let's boost your social media.
Absolutely.
Let's get it going. I think I know people out there that are going to be watching that should be liking you and following you and all the things. So is there, and of course, all those, the email, the social, all the things, the website will be in the show notes. As well, if you want to reference.
And so Monika is a local to the Austin area. She's a midwife in Austin area.
Greater Austin.
Yeah.
Yes. But then from your FDN work, you can work with anyone in the world.
Anyone in the world. That's the beauty behind this amazing community. Look up FDN. They're amazing. That's why I chose them.
Yeah. Well, and that's why I was bringing up, because our audience is worldwide.
Yeah.
And so if someone is working with an OB or maybe a midwife that's not well versed in these things, work with you on some things, and then they're still working with their local practitioner. I think that would be a great scenario. Well, cool. Is there any other things, any other discussions you want to have period, whether home birth or anything that you want people to know about?
I would like to close with one thing, if that's okay, or want to talk about one thing. So I have been in this birth world, like I said, for 23 years, and we see the pendulum swing sort of both ways in those 23 years, that things shift and change, and clients, different generation approaches birth differently and so forth. Right now, we're seeing a lot of more clients come in that are very hesitant of anything, like what is very crystal to you. We're doing a sonogram halfway through the pregnancy. Right now, there's so much information and so much also disinformation, and so much, people are really very careful since, 2020. And everybody is sort of throwing out the baby with the bathwater, that all is bad. And all isn't bad. And it is important to be judicial a little bit. Find a midwife that you feel it's always a choice from the heart. The midwife you choose is a choice from the heart. And in the consultation, every midwife offers an hour consultation, really ask how she works, how she feels about sonograms, how she feels about routine testing and treatment. And there is, and see where you fall. Right now, my personal struggle is a little bit, I am open to people declining sonograms, declining the use of Doppler in the pregnancy, but that isn't the thing that is evil. That isn't the one thing that is going to make or break this pregnancy. Let's not be so far on one side that we decline now everything. And that has been a lot more challenging in my world. When I ask, hey, I need this information, people aren't as interested in it. And that's because they're really jaded. There's something in their ear that all is evil. Right. And so I will work with everybody. I'm very clear what I feel comfortable with and not comfortable with. But people need to also just be careful who they listen to.
Yeah.
Yeah, because 1 10-minute sonogram at 20 weeks versus some of these OBs will do a check-in every 2 weeks.
Exactly.
There's the risk to benefit for a 10-minute ultrasound.
Yes.
When you're having a baby at home, to know that this baby is coming out with its heart inside of its body, with its bowels inside of its body.
Exactly.
Like that is a big thing. And that is also important for you as a midwife and your risk.
Yeah.
I could see how that is very comforting to know what's going on with the baby.
Yeah. Yeah.
Yeah. I think it all comes down to not having a dogmatic stance, right? I mean, I'm holistic. I mean, look, I made Sarah a placenta smoothie after, the birth, and I tried it myself.
With vanilla ice cream and strawberries.
So I'm about as holistic as it gets. However, I will not be dogmatic. And if there is a procedure or something that carries a higher benefit to risk, why would I risk Sarah's life? I would never risk Sarah's life, nor would I want to risk my baby's life. So I think it's just this concept of, hey, you are the expert. You've forgotten more about how to deliver a baby than I will ever know. So why would I go to Google and try to outsmart you, unless I just didn't trust you, in which case I shouldn't be working with you. Right.
And, I welcome that. I really welcome, I tell my first time parents, go ahead, research everything you can find. You open new doors, or even people who are new to home birth. Once you get to your second, third, you just don't have that time. But I am the kind of midwife who is like, research as much as you can and bring all your questions, bring all of this to me. But at the same time, and we will have a discussion, but it feels to me, and I'm not sure I'm very good at explaining this. I want to be clear that I do work with people. I am delivering babies because, and this is newer in the last 2 years, that people come to me, they say zero sono, no Doppler use in the pregnancy, and we will only listen with fetoscope. And I honor that and so forth. But it makes my life more challenging. And it does, and I can honor it, and I wouldn't do it if I wouldn't be comfortable. But at the same time, I'm like, this is part of my risk assessment. Yes, and is the baby healthy? Can, let's look at that sonogram. It isn't also not the end all be all, but it's like right now we're throwing the baby out with the bathwater, and right now we're also throwing the midwives a little bit under the bus, and that leads back to where we originally started. No, midwives are not immune to practicing coercion. They're not immune to, doing interventions. But this therein lays that you be very careful who you choose,
Mm-hmm.
Yeah.
Well, it's amazing. Thank you so much for coming in. This was an amazing conversation. I'm so happy that we had it, because I think that this was a very educational discussion. I hope that we open the eyes of some people, that are watching, and at least made people start to think through this process a little bit better. If we can impact how one baby is born, our job's done here.
Right.
So I'm very happy about that.
Mm-hmm.
Sarah, did you want to add anything to the discussion today?
I think it was
Thank
awesome.
you for joining us.
Yeah, I was happy to be here. Yeah, and thank you. We
Awesome.
love referring patients to you. Clients and employees and everyone.
Yeah.
So thank you for
It's been
being
an
here and
honor.
holding that birth sacred.
Absolutely.
We've been on a journey. It's been an honor.
Well, so everyone listening, if this information can help you, please use it to its fullest potential. But if this information can help someone you love, please share it with them. Send it to them and tell them, look, you need to listen to this. Just listen. It's just educational, guys. Okay. And again, let's go out and let's like and follow Monika. She's doing amazing work. You heard her. She is literally transforming the landscape of home birth and health and wellness of families in so many different ways. So please find her, like her, follow her, etc. Go get her book. And when her new one comes out, please get the new one as well. I'll be posting about it, sharing it, and everything as well. So thank you so much for tuning in, and we will see you next time.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice, brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandoncrawford.com.